Hi, this is Charles Woodson, and today I'm going to be sitting and talking with some very important people, my VIPs, and these are doctors and researchers who have benefited from the Charles Woodson Research Fund at the University of Michigan C.S. Mott Children's Hospital. I started the Woodson Fund maybe 10 years ago now, and the purpose of my fund was to fund research. There's so many different things out there that are affecting people, and in particular children. And we need, smart, dedicated people who are trying to attack these problems each and every day of their lives and trying to make a difference. And so today we're going to start the conversation with Dr. Cousino, and she is going to tell us a little bit about what she does and how she's benefited from the Charles Woodson Clinical Research Fund. So with that said, I would like to say hello, Dr. Melissa Cousino. How are you today?
I am doing so well, Charles. Thanks for having me. It's really great. I'm a big football fan, but an even bigger fan of all that you have done for our children's hospital and for the science of pediatric research. And so it's really exciting to share some of this work here today with all of our viewers.
Thank you. Well, I heard that there was a signed Woodson jersey or something that you might have had that could have been in the background. I don't see it. Where is it?
My husband saved up his money when he was younger to buy a Woodson jersey. His parents would not let him buy it, but as an adult, they gifted him a signed Woodson jersey. It is in his office, not in mine, but I should have borrowed it for today's occasion.
That sounds crazy when you say that he has to save up money to buy a jersey. We might have to talk to some people about that and maybe cut some costs or something.
Yeah. It's amazing that through football, you've been able to do so much important work here at our children's hospital, and to give back to Ann Arbor, to give back to the community. It's amazing what small grants of $15,000, $20,000 can do for an early researcher's career, and then what that leads to in the future. I'm a pediatric psychologist, so I work a child psychologist that specializes in working with kids and families facing chronic medical conditions. Specifically, I work with kids with heart disease and kids who need organ transplants. And you know this, Charles, but for those listening in today, of the entire national budget for research, less than 10% goes to child-focused research. And so when you think of all of the diseases that impact children, all of the mental health conditions that impact children, the child development questions we have, obesity and learning and education, less than 10% of that budget is going to our youth. And so, but we have so many important questions. We have so many important needs. And so this fund allows us to get started. It allows us to lay a foundation, to make a play, to start the story that then allows us to build into the future and hopefully secure larger grants to continue our work. So it's really, really important.
Well, I mean, let's kind of dig into that, exactly what you do, and in particular, the psychology part of it. And so when you say that, what do you specifically mean?
Yeah, so, as a psychologist, I always tell my friends and colleagues in medicine that my most common procedure is listening and talking. So, I don't look in the ears, I don't give shots, I don't do surgeries, but listening to the experiences our patients and families are having, responding to those emotions, and then giving them the skills to be resilient and to thrive amidst really hard circumstances often is what we as psychologists do. And, all of my research has been driven by with patients and families and career as a pediatric psychologist, that our patients themselves, the adolescents, the young adults that we're working with, they have preferences for how their healthcare is delivered to them. And they often, how we talk with them, how we engage them in their medical decision-making matters. But we as parents and as healthcare clinicians tend to do a lot of that work adult to adult, and we want to kind of protect the kids. We feel like sometimes these news of these big surgeries or these life-threatening complications may be too much for them to handle. And as a psychologist, I was seeing that this was really having an impact on our kids. It was, leading to later problems with taking their medicines. It was causing them a lot of distress, anxiety, isolation, kind of feeling left out. I really wanted to study this, particularly in pediatric heart disease and transplant. And so 2016, I applied for a grant through the Charles Woodson Clinical Research Fund. And with about $20,000, we did 2 studies. The first was, to just get a lay of the land. What is it that our patients themselves want? These are all kids facing the need for heart transplant. So heart transplant is one of the most significant procedures that we do in pediatrics. And while it offers really great outcomes, there are still considerable risks of mortality and morbidity. And so adolescents and young adult patients themselves, and I said, when facing this, what is it that you want to know? How engaged do you want to be in this process? Do you like it when the doctors tell you your prognosis? Do you like it when the doctors tell you the risks of transplant? Do you want to know all of that? And the majority of them, 83% of them, said, yeah, we want to know. We want to be involved in this. We then did a second study where we asked transplant clinicians throughout the world, how often are you having these conversations with your patients? How regularly are you talking to that 13-year-old themselves or that 17-year-old themselves about what they're facing? And only 20 to 30% of us were regularly having those conversations. And when we asked parents also said, I don't think my kid wants to talk about that. I think these conversations should occur between me and the doctor. And so it was a real gap in what our kids want themselves and what we were actually providing to them as parents and as healthcare providers. And so with the pilot grant through the Charles Woodson Research Fund, we were able to lay the land in this area.
So you have these young kids who are they're about to go through a life altering, procedure. Like they want in on it. And they feel like, doctors and parents are talking over their heads and making these decisions as if they're not even a part of, the particular surgery or whatever they have to do. My next question would be, how difficult actually were some of those conversations with the kids? That's a pretty heavy conversation to have with the, 11, 12, 13-year-old to say, hey, you may need this heart transplant. How do you feel about that? That's got to be a tough conversation to have.
Yeah, I think you'll appreciate this, though. What I've learned in doing this research is that you just have to have a game plan ahead of time. So when you just ask them, okay, we've got a lot of tough things to talk about. How do you want this information? When do you want it? Who do you want to talk to you about it? If it's becoming too much, do you want to give me a signal for when we should stop, when you want out? And when we just make a plan for how the conversation is going to go, kind of based on their preferences, most of the time, these go incredibly well. And we actually know from the research that when we follow their preferences and we provide communication that aligns with their preferences, even if the news is tough, even if the news is sad and scary, that from a mental health perspective, they actually do better long-term. And so it's really important to build a game plan with them ahead of time, and then make sure that we provide care that's really consistent with that. So we actually took this pilot data from the Charles Woodson Clinical Research Fund, and then we've been able to, in the past 4 years, get $1.5 million in federal funding to look at this even bigger scale. So now we're going to have to meet again in a couple of months so I can tell you what we found. But right now we're looking at when we communicate with them in the way that they've asked us to, and when we engage them in their healthcare in the way that we've asked them to, how does that impact their longer term outcomes? So is their mental health better long term? is their heart health better long term? Are they more likely to, take their meds and follow up with their appointments if we engage them in a way that's meaningful to them? And then starting next month, we're starting to build an intervention with 30 kids and parents to actually provide our healthcare teams and our parents with the tools they need to engage kids in the way that they want to be engaged. So, what started off as, an idea from patient encounters and $20,000 of funding has become, 2 federal grants and ability to make change for many more kids.
And I have to imagine that, you have these conversations before the kid actually goes into surgery. I have to imagine that after they come out of a surgery, that communication wise, they've opened up some and more willing to talk to you and kind of tell you how they feel and what they feel like they need going forward.
Yeah, absolutely. I think that, we're learning mental health is such a huge part of physical health in general. And so I think by involving the mental health approach from the very beginning, where we're listening and we're reflecting and we're learning about emotions and worries and what makes kids tick or not from the beginning, they then realize this is just part of our healthcare. And so they wake up from surgery and they're worried or they're sad because now these scars make them look different from their friends. They feel like they've been heard and that they can come to us and that will work with them with those feelings. So I think engaging them from the very beginning lets them know that we're here to support what they need throughout their course.
And you said something that was very important a few moments ago. You got the seed money from the Charles Woodson Clinical Research Fund, which is, what the fund does is we provide the seed money so that you can get started in your work, but then hopefully that you can get federal dollars. Like you said, I think you said up to $1.5 million. I think it's important for people to know, what that money goes towards, exactly what it goes towards and why, the importance of raising money and you guys being able to continue your work. I think it's important for them to know where it goes because then people feel more attached to it and are more willing, to give and be a part of what we're doing. So I think that's important that you mentioned that. And if you could, just expound upon that just a little bit more, that would be helpful.
Absolutely. I actually submitted a federal grant before I got the Charles Woodson seed funding, and it wasn't even discussed. It means you send it in, and they didn't even get to the score or the level of being discussed at the bid meeting, which can be really disheartening. But then with that seed money and this ability to tell a story with data, I could tell the story as a clinician. I can share my patient stories, and I know that it matters. But in science, we need the data. We have to really say, like, look at this gap. 83% want this, but only 20 to 30% are getting it. And then, with that story, with that data, we were able to go after that small pot of money that the federal government gives to pediatric research. And we had a story that showed this was really, really important. And so now with that bigger funding, we're recruiting larger samples of kids, not just focused on transplant, but on other diseases as well. So we can see how this impacts other decisions, not just transplant surgery itself. And this intervention is going to eventually be available at other children's hospitals. And so, what we're able to offer a 12-year-old patient here at Mott, hopefully will be just as helpful for that 17-year-old in Texas who's facing these same conditions. And, without those research dollars, we don't have the staff to help us with recruiting patients. And we also, will thank our participants for their time. They're very sick and they're helping us with their research. And so we want to acknowledge that the time that they're giving to this work. And so, that's part of the research dollars as well. our small stories, small amounts of data, but raise them to the level that they are noticeable and that they're significant and that we can do more work.
Well, I would suppose that if adults are